So we actually stumbled on heart being part of it, more or less by coincidence. We then decided we're going to then scan patients, we're going to investigate them after they have recovered from the acute illness. This, to a certain extent, brought us to patients that were not so severely symptomatic during the acute phase. So many of them perhaps had a little bit of a temperature, but that was it. So really, in terms of typical COVID symptoms, they didn't always have them. And we were quite surprised by what we have found on the heart, because we did not expect this, to be very honest. We were shocked to see that 78% of them have had something on the heart that we could relate to COVID-19 infection. This was mainly inflammation of the heart muscle, that is myocarditis, but also pericarditis, which is inflammation of the heart's lining. Now, at that point, we also started understanding that they are symptomatic. Then, that means after the infection, that was weeks, months after the infection. So we basically got ourselves into this time frame of long COVID. And more and more, we see this type of patients who simply struggle to recover. And the presentation is mainly through shortness of breath. In young patients that are fit and sporty, they observe they cannot regain the fitness level that they used to have before. We have a lot of patients that obviously are sporty. A huge group of our patients had unfortunately got their infection while being on skiing holidays in Austria. That was the most prevalent source. To put it a little bit in a broad perspective, about a third of patients have a very severe myocarditis. That means very active inflammation of the heart. And this, to a certain extent, may be or may not also be very, very prominent in terms of symptoms. So some people may not be aware of that. And even though I must be very clear, we have not actually investigated professional sportsmen. This type of population is hugely at risk when it comes to inflammation of the heart, because obviously they put a big strain on their hearts as they try to regain their fitness. So I think it is important to understand what's going on in the heart. And by this, even if we don't yet have any idea how to treat this, inform the patients, inform them about the state of things on their heart, and by this guide also their recovery. And when it comes to professional sportsmen, this is a matter of life and death for them. Also mentally, professionally, they really want to go back to where they've been before. But perhaps it is slightly safer if they do this a little bit slower. So on one hand, it is changing the lifestyle. So being a little bit slower with everything, with expectations. Now, the other side of the things where we could help is obviously medication. And this is where we were caught out as a humanity, because so far we have been really not looking so deeply into inflammatory conditions of the heart. And this is also, apart from looking at outcomes, at natural course of disease, this is our next thing on our to-do list, to start clinical trial with intervention to protect the heart as a cardioprotection treatment in patients with COVID-19 myocarditis. But because we are simply learning about it. And this is the honest truth. And we need to learn what also happens, not just immediately, as in 3 months down the line from the infection, but in the long run,